Evelyn. I'm
Hi.
going to be your nurse today. I'm going to take some history first and then do a head-to-toe assessment.
Okay.
All right. Can I get your name?
Alexis Ramirez,
All right. And your date of birth?
7/12/88,
And your race
is Hispanic, or half Caucasian,
and religion?
is Catholic.
All right. And what is your highest education?
It is associate's degree in nursing,
All right. And your marital status?
single.
And then what is your reason for the visit?
Well, the reason I came in is because I have a left ankle injury.
And how, when did the pain start?
The pain started an hour ago. I was playing slow pitch softball game and slid into third base and hit my left foot in the base.
Alright, and where is the pain located?
It's right on my ankle, my left ankle.
Alright, and how long does the pain last for?
It's a constant pain.
Alright, and what kind of character? Is it throbbing? What things do you do to help?
It's a throbbing pain. The pain gets worse when I walk on it. It seems to be less painful when I elevate it.
Alright. And then anything, just walking makes it worse?
Yes.
And have you put any ice on it?
I have iced immediately after the incident happened.
And did that help it?
It did.
Okay. And
It did a little bit.
a scale from 1 to 10, how would you rate the pain?
About a 6.
Okay. And how has this affected your normal?
I just can't walk well at all. It hurts to do anything. I have to be careful what I do all the time, especially for what I have to work for and whatnot.
Alright. So now I'm going to go more into your past history. Have you been hospitalized?
No.
Any surgeries?
No.
Any injuries?
No.
Any mental health disorders? Any depression? Anxiety?
No.
Alright. And your last physical?
Was last year.
And your last pap smear?
It was 2 years ago.
Okay. Any abnormalities?
No.
Alright. And did you get a STI test?
Yes.
And it was negative?
Yes.
And do you get your blood checked every year?
Yes.
And is it normal?
Mm-hmm.
Alright. And your last eye exam?
A couple years ago.
Any vision problems?
No.
Okay. And do you perform self breast exams?
Yes.
And how often?
Monthly.
Alright. And are you up to date on all your immunizations?
Yes.
Any allergies?
I'm allergic to penicillin, not penicillin, to the pertussis vaccination.
And what happens when you have them?
A rash and hives.
Alright. And I'm going to do some GYN history. When did you start your period?
12 years of age.
Okay. And your last menstrual period?
A couple days ago.
Alright. Any problems with your periods?
No.
And any pregnancies?
No.
And what do you use for contraception?
Norplant.
Okay. And talk about family history. If you can tell me about your dad.
Dad has history of hypertension, some alcoholism, and obesity.
And his parents?
His father passed away from COPD. His mother is alive and well, but she does have rheumatoid arthritis.
Okay. And any siblings?
Yes, I have 2 sisters and a brother, and they're all alive and well. Younger sister's a little overweight, but...
Okay. And your mother and her family?
Mom is alive and well. Her mother has lupus, and my grandfather is alive and well.
All right. And where do you work?
Presbyterian Hospital.
And how long have you worked there?
Worked at Presbyterian for 5 years, as a nurse for 2.5.
Okay. Any history of physical abuse?
No.
And do you feel safe at home?
Mm-hmm.
See, any tobacco or drug use?
No.
And do you consume alcohol?
Yes.
And how much?
About 1 or 2 glasses a week or so.
Okay. And what do you do for exercise?
I run a lot, probably about 5 or 6 times a week.
Okay.
Practice yoga.
All right. And do you wear a seatbelt
Yes.
and wear sunscreen?
Yes.
And how would you describe your diet?
Healthy. Eats fruits, vegetables, meats, in moderation. I try to eat in moderation.
And any caffeine or coffee?
Yes, I drink at least 2 to 3 cups a day.
And
Tons of water.
okay.
Yeah.
Next question. Awesome. All right. So that completes my history on you. I'm gonna start your head to toe assessment. So I'm gonna wash my hands. All right. I'm gonna first look at your scalp. I'm gonna be looking at your texture of your hair. Make sure your scalp is intact and looks good. And then I'm gonna check your cranial nerve 5, your facial nerve, and I want you to if you could purse your lips and puff your cheeks and show your teeth. All right, and then can you grit your teeth? And I'm gonna check for cranial nerve 5. That looks good. And then while I'm doing this, I'm also looking at your face. Your face is symmetrical. If you can smile. Yep. Face is symmetrical. And okay, I'm gonna stop.
You said cranial nerve